Hello everybody, I'm Dr. Ahmed Al-Khair, and today we're going to talk about chest pain. We're going to talk about the most common causes for it, as we all fear heart attack. But we should know it's not the only reason, and in some cases it's not even likely to be heart attack. And now we're going to talk about the characteristics of heart attack, which we call in the medicine acute coronary syndrome. The pain here would be retrosternal, which means right here, central. It start acutely and gradually increase in the severity. The pain would be more of a dull pain, squeezing or pressuring. Many patients would say that the pain is spreading to the left shoulder, left arm, neck, jaw, or even the epigastric. This is very important because many epigastric, or let's say gastric diseases, actually mimic the chest pain. Also, many patients would say they have shortness of breath. They would look very pale. And there is a group of symptoms we call the parasympathetic symptoms, which are nausea, vomiting, excessive sweating, dizziness, lightheadedness, and syncope at the end. These group of symptoms are mostly connected to the heart attack and not other reasons for chest pain. And now we're going to talk about the non-cardiac reasons for chest pain. The two most common causes are either musculoskeletal or gastrointestinal. The musculoskeletal, there's two cases actually. The first one, which is costochondritis. This is an inflammation to the costal cartilage up here. So the pain in this case would be localized. The patient would clearly be able to say that this is where it hurts, because this is where the inflammation is. Now the pain here would be triggered with palpating the cartilages, as well with taking a deep breath. When you take a deep breath and you do this, the chest cavity expands. When this happens, the cartilages are going to stretch, and this is going to trigger the pain. Some patients actually misunderstand this feeling as shortness of breath, but this is wrong. Costochondritis is not accompanied by shortness of breath. Another cause, which is muscle spasm actually. The pain would be acute. It would be on the left side of the chest or on the right side of the chest. The pain doesn't really look like the heart attack pain, even though that some patients say that it's spreading, but it's just spreading pending on the area or the surface that the muscles covers. I should state something very important, that costochondritis would be most likely in a patient who has been under stress for a long period of time, or in a patient who had recently had chest trauma, or after some serious exercise. Whereas muscle spasm would be the most likely cause in a patient with a bad diet, patient with low potassium diet, patient who has been excessively exercising the pectoris major muscles. Or let's say a patient who has been sitting in a position where they put too much efforts on that muscle. And now we're going to talk about the gastrointestinal reasons for chest pain. The most common reasons in this category are either gastritis or gastric ulcer. Those would be most likely in a patient who has been drinking too much alcohol lately, in a patient who's been taking NSAIDs, or even a patient who has infection with Helicobacter pylori. The pain as well will be more of an aching, would be in the epigastrium, sometimes which would go up into the chest, which would imitate the heart attack, but the pain would be clearly differentiated because in this area, in this case, you would have dyspepsia, some patient will have heartburn, they have the history of NSAID and alcohol. Now for the other cause in the gastrointestinal group, which is esophageal hypermotility disorders. The pain in this cause imitates the heart attack a lot because it is central, right where the esophagus is. It is more of a squeezing pain as well. Patient might say they have shortness of breath, but that's not really very clear, let's say. The most important thing that this pain is accompanied with dysphagia, which is like pain when you swallow, and mostly when you drink, not when you swallow solid food. And now we have talked about the heart attack and the characteristics for it, and we have established the reasons for chest pain. And I think we have made it clear how the pain differentiate between the groups. I should state one very important thing, which is the parasympathetic symptoms are mostly found in the heart attack. So if you're having chest pain, as well as, let's say, nausea, vomiting, sweating, dizziness, syncope, you do want to see your doctor. I hope you liked this video. Please, if you did, share it in your story so everyone can see it and stay safe.